Kamran. I'm a general surgeon with vascular interest. I also board certified in phlebology, and I'm a clinical professor at University of North Carolina, Chapel Hill. Today what we're going to be talking about venous disease. Pretty much everybody knows about veins. What we're going to be talking about is the modern management of venous disease. Again, there's more art than science to medicine, so what you're going to hear is my own interpretation of how things got to be done. I'm very biased, so it doesn't necessarily mean that this is definitely the way to do it. Okay, having said that, we're going to start off with our slides. I've got quite a few slides. I'm going to go through them very fast. At any time you want me to slow down or stop, I'll be more than glad to. But one request I have, please hold the questions right to the last, till I'm finished. When I'm finished, I'll definitely answer all the questions that you might have. Okay? All right. What we're going to be talking about is venous insufficiency and its modern management or treatment. A very basic question, circulation. The way the blood gets to your legs is through the artery, and the artery is, again, on the right-hand side, of course. Whoops. There it is. So that's the artery. That's your heart. Blood gets through your leg arteries, gets into the leg. The part they don't have in here is the capillaries. The capillaries are so small that by the time the blood gets to the other side of the capillary, the pressure is zero. There's no pressure. The only way the blood gets out into the vein and get back into the heart is through the muscles here, the calf muscles. This is a normal valve, which is open. This is a closed valve. And there's a leaky valve. I won't go into all the details about why valves become leaky, but the bottom line is when the calf muscles contract, blood goes up. When the muscle relaxes, the valves close, blood can come back down. We call it the domino effect. The first valve it usually gives is around in the groin area, the saphenofemoral junction. When that valve gives, then you have this column of blood. You've got much higher hydrostatic pressure. You've got more pressure on the second valve and then the third valve, and then they all start giving. Because as these valves fail, the wall gets stretched, and these valves are connected to the wall. So as the wall stretches, the valves continue to become incompetent. This again is a nice slide here with a closed valve, and this is an open valve. This is a video. These are the calf muscles. It runs very quickly. So this is a valve failure. And you can see the muscle that goes up. When it relaxes, the blood is supposed to stay put, but it comes back downwards. These are my own slides. We have a very high resolution ultrasound machine. We are actually Center of Excellence for Zone Air. And we have the best ultrasound techs you can imagine. We have 4 of them who work for us. I was talking to Dr. Chase actually yesterday, and he was just amazed at some of the quality of pictures we're getting. As you could see, this is literally seeing the blood inside the vein wall. This is a diseased vein. You see how it looks like. Some people ask me if they could be used for coronary bypass. I don't think you want these babies in your coronaries. And you saw the valve there, which is not working well. This is another picture. This is a cross-section of the valve. You can see the 2 edges. So you can imagine it's like a bat's wing, really. There's a soft part, firm part, and you can see it's not closing properly. There's another valve. You can see the big gap in the middle. This valve is actually calcified. When a valve is diseased for a long time, it just builds calcium on it. So, and you can almost see the blood just sitting there, stagnant. And if you're squeezing the muscle in the leg, trying to push it up, it just sits there. It doesn't do very much. Can you see this fish mouth? The mouth is wide open. And only very high resolution ultrasound, quite frankly, with good ultrasound taste can show you this. This is a muscle here, and the veins are here. We call these perforators. As the vein comes across, they have little roots which go deep to the muscle, and that's what perforators are. And what I was showing you here is the valves inside the perforator are not functioning. There's one here wide open. You can see the gap. You can see the gap here. Look at this, wide open. Now here we're in color flow, and just to show that blood basically goes in both directions. We use the Doppler signal here to actually measure the amount of reflux. You can see after we squeeze the leg, we let go, it should be just one line, and it goes on for almost 2 seconds. It should be 0.3 seconds for a perforator. This is my favorite picture. The other day we were so bored in the office, somebody was actually talking as this was moving. Somebody says that you must have a very boring life if you talk to valves, but only, this is cross-section. Can you see how the mouth is wide open? So the blood just goes in both directions. This is not if this was in your heart, you would have valve replacement. If it was in your anything, it just needed to be replaced. It's not functioning. I can go back and forward, right, with this, so you can show it again. Now the symptoms. Symptoms are very interesting. I actually, just before I left, I went back to Schwartz's textbook of surgery, which is that's the book everybody reads to become a surgeon. I also looked at Harrison's textbook of internal medicine. And the symptoms are quite vague. And I tried to get as many symptoms as I possibly could between the two books and what is talked about. Aching legs. And everybody's got aching legs, so what is exactly aching leg? Well, at the end of the day, the legs feel very tired, they feel heavy, they're very engorged. The best way I can describe it is when you have venous insufficiency, it is like being in the middle of an escalator. People are getting on, but people are not getting off. So you stay very congested in the middle. And so if you have a tourniquet in your leg, if you have a tourniquet in your arm to give blood, just imagine having one on your leg. As the day goes by, the leg is getting darker and a little heavier. It just can't drain. Blood can't drain from it. Obviously, all the oxygen is extracted from it. Dull aching. Cramps are amazing. Night cramps are very common. I went back to my Schwartz textbook of surgery. It is about 4 or 5 years old. And he said, these people do get night cramps. He said, but give them the stocking. If that doesn't work, give them some quinine, because quinine actually relaxes muscles. Well, not really. It doesn't do anything. I gave so much quinine in my lifetime. Believe me, it is just like holy water. It doesn't really do much. And the other thing, of course, people use this potassium. They just eat a lot of bananas, a lot of tomatoes. And my thought about that is, if your car is full of gas, if your gas tank is full, if you put more gas in it, do you think it would run faster? If your potassium is normal, you can take all the potassium in the world you want. You don't need any potassium. If your potassium is low, you can get cramps. But if your potassium is normal, you don't get cramps. And in fact, it's very unusual to get a low potassium unless you're on your diuretic or you're sweating like crazy or have severe diarrhea. But hypokalemia or low potassium doesn't happen very often. So potassium has nothing to do with it. When these patients came back, and I'm going to show you some of the testimonials, they were always telling me how the night cramps were the first thing to go. And the second person, and the third. And we've done 10,000 cases now, just laser ablation. And I'm just amazed that the night cramp is almost the first thing to go. After we take care of the veins. Discoloration, we show you all those. Heaviness, itching. Itching goes with dermatitis. When you have some redness on the inside of your leg, above your ankle, it's always on the inside of the leg, but it could be on the back as well. The skin gets a little red, dry, and then it itches. Usually, I see a lot of these patients being to quite a few dermatologists, and they've tried hydrocortisone cream and all kinds of things. At the end, they, after a year, they come back and see us, and we find that that's related to the vein. Dermatitis means inflammation of the skin, and venous dermatitis because it's related to the veins. Tiredness, we know about throbbing. especially some of those varicose veins where that perforated was I was showing you. It really pushes on the muscle, on the fascia, and really hurts. We used to do a procedure called SEPS procedure, which we don't do that very anymore. At least I don't. We used to go there with the laparoscope and put it over the muscle underneath the covering of the muscle. And we would create a space, and we would go and close all those perforators. But I was amazed how these veins had literally tore the fascia. The fascia is that hard white piece on a stick that you can't cut through, you can't chew. That's how tough fascia is. It literally had ripped that fascia. So this throbbing pain, like some patients feel there's somebody is sticking a pen or something into the leg, that's usually from the perforators or from varicose veins. Swelling, restless leg, sharp pains, and leg ulcers. Well, these are fair enough to mention in books, but where did they come up with these? By talking to patients, I assume. We learn in medicine, we learn their symptoms from what patients tell us. And when we cure their disease, their symptoms go away. So we've decided these are the symptoms that patients should get. But this is what you get in the textbooks. And I thought, I'll do better than that. I said, I'm just going to write all the comments that my patients make and make a copy of that and put that on this slide. There's one thing I do, and this is the honest truth. I get all my patients, when we do the procedure, we give them a piece of paper, and we give them a comment sheet. We said, how does your leg feel since you've had your procedure completed? And I call it uncut, uncensored. Whether we like it or not, that goes on our website. The beauty of it is, when we wanted to get them, we went right there, John and I. We picked up about 100 of our comment sheet about how patients feel afterwards. And I put those on the slide here to just confirm that a lot of these things do happen. These are the testimonials. A lot of patients tell me once their leg is done, the leg is not, it feels lighter, it's not as heavy. And these are the handwriting. These are different people. It's not the same person, obviously. This patient says, my legs feel great and lighter. It's much lighter. These are different days. Some of them a few years ago. Some of them 6 months ago. I don't think they talk to each other. Okay? This is their comment. And what I was talking about Charles Darwin, just by listening to your patients, you learn so much. Leg is lighter. Less tired, lighter, no pain. Leg is lighter. My leg feels lighter. Less heavy. I guess that's kind of lighter. My legs feel less heavy and tired. My legs feel 20 years younger. I feel as though I was dragging 10 pounds. And believe me, some of the people sitting in the audience here, you're my patients, and you've already told me that. And it's really, it's not as heavy as before. Less heavy in my legs, which was treated. Less heavy, not as heavy. They don't feel as heavy. I think we proved that there's less heavy and lighter. We got that out of it, okay? What about improvement with night cramps? Has gotten much better. The heaviness and legs cramps I experienced before are practically gone. I'm thankful my discomfort is gone. No cramps. Cramping has already gone 1 week after my first procedure. Laser combat, I have more energy when I'm walking. We hear about, by the way, about energy. I'm doing my own study about seeing if I can show an improvement in the patient's cardiac output after we've taken care of the veins. We're literally starting the trial the next week or two. But a lot of patients tell me they have more energy. Improve the sleep and restless leg. Has gone away. Actually, I've done a few nights with some of the best sleep I've ever had. I had one patient who told me he can now sleep with his wife again because apparently he used to move his legs so much that she had asked him to sleep in another bed. Less pain. My leg doesn't hurt anymore. No pain. Again, no pain. The pain in the calf are gone. No leg pain.